Screening for chlamydia trachomatis infections in women. Chlamydia trachomatis is one of 4 bacterial species in the genus Chlamydia. Chlamydia is a genus of pathogenic bacteria that are obligate intracellular parasites. Chlamydia trachomatis is a gram-negative bacterium. It is ovoid shape and non-motile. The bacteria are non-spore-forming, but the elementary bodies act like spores when released into the host. The inclusion bodies of Chlamydia trachomatis were first described in 1987 by Stanislaus von Prowazek and Ludwig Halbesser during research on trachoma. Let's see a video.
Human pathogen that has 3 human serovars that cause disease. Serovars A to C causes trachoma, an infection of the eyes that produce a characteristic roughening of the inner surface of the eyelid. Individuals commonly experience symptoms of follicular conjunctivitis and experience non-specific inflammation and thickening of the papillae. Concave inflammation can lead to scarring of the eye.
Identification. Chlamydia species are readily identified and distinguished from other chlamydia species using DNA-based tests. Most strains of Chlamydia trachomatis are recognized by monoclonal antibodies to epitopes in the BS4 region of MOMP. However, these MBRVs may also cross-react with 2 other chlamydia species. Clinical significance. Clinical signs and symptoms of Chlamydia trachomatis infection and gonorrhea infection are indistinguishable. Both are common cases of meningitis. Chlamydia trachomatis is the single most important infectious agent associated with blindness, trachoma. About 84 million worldwide suffer Chlamydia trachomatis eye infections, and 8 million are blinded as a result of the infection. Presentation. Most people infected with Chlamydia trachomatis are asymptomatic. However, the bacteria can present in one of 3 ways: genitourinary, genitals, pulmonary, and ocular. Genitourinary cases can include genital discharge, vaginal bleeding, itchiness, painful urination, and other symptoms. Often, symptoms are similar to those of a urinary tract infection.
Viruses cannot divide outside the cell, so they will come and attach to the host cell. After the attachment, they will guide the host cell to engulf them inside the invagination or endocytosis pathway. After this endocytosis is done, this chlamydia or elementary body is now inside the vesicles. They will start to thrive and start growing and dividing inside this vesicle. Sometimes they can also come out of this vesicle to the cytoplasm and then start growing and dividing several times. Now as they are growing and dividing several times, as you can see here, right? So what we can see here, once after they are internalized, the recognition and they are converted into reticulate body. So once which was elementary body, after the engulfment, staying there for few while, they will be converted to reticulate body. So their structure will be
Prevalence. 3 times as many women as men are diagnosed with genitourinary chlamydia trachomatis infections. Women aged 15 to 19 have the highest prevalence, followed by women aged 20 to 24. Although the rate of increase of diagnosis is greater for men than for women, risk factors for genitourinary infections include unprotected sex with multiple partners, lack of condom use, and living in an urban area. Treatment. Treatment depends on the infection site, age of the patient, and whether another infection is present. Having chlamydia trachomatis and one more other sexually transmitted infection at the same time is possible. Treatment is often done with both partners simultaneously to prevent reinfection. Chlamydia trachomatis may be treated with several antibiotic medications, including azithromycin, erythromycin, or ofloxacin. Laboratory tests. Nucleic acid amplification tests find the genetic material of chlamydia bacteria. These tests are the most sensitive tests available, meaning they are very accurate and very unlikely to have false negative test results. Nucleic acid hybridization tests also finding chlamydia DNA. A proof test is very accurate, but is not as sensitive as NAATS. Direct fluorescent antibody test also finds chlamydia antigens. Conclusions. Reinfection within 1 year after treatment of chlamydia infection occurs in 20% of female patients and substantially increases the risk of pelvic inflammatory disease, ectopic pregnancy, infertility, preterm delivery, and low birth weight infants. Expedited partner therapy has proved to be effective in reducing the rate of reinfection. As a result, the Centers for Disease Control and Prevention, along with many professional health organizations, supports expedited partner therapy as an evidence-based practice to prevent chlamydia reinfections.